Hello, everyone. I'm Dr. Bitner, co-founder of True Women's Health, here with my partner, Dr. Egan.
Hi.
And hello, and I'm so excited to learn about this with everyone else about a condition called lipedema.
Yeah, so as a lot of our patients know, and for those who don't know, I'm an internal medicine doctor, but really what I love doing within internal medicine is helping people lose weight. And so I got board certified in obesity medicine, and it was really my work with patients who had obesity that I learned about this condition called lipedema, which is what we call an adiposity disorder. So our adipose tissue are our fat cells. And what this is a disorder of our fat cells that are in what we call our connective tissue. And I think of our connective tissue as sort of that like squishy stuff around our bones and muscles, and it holds a lot of things, including our fat cells.
So tell me what does lipedema mean? So like, how did you first start thinking about this? Was it a certain patient that you saw or?
Yeah, actually, it was probably a collection of 3 or 4 patients that came to me and said, I have lipedema. And I was, a bit side-eyed of being like, well, what does that mean? And what they described is this sort of pattern. So it's mostly a disorder of women. And oddly, it affects a lot of women. About 1 in 9 women have lipedema. And the stories that they say have a pattern to them. So it usually is expansion of adipose tissue, usually at hips, buns, and thighs during times of huge hormonal shifts. So women will talk about puberty or pregnancy, menopause, or maybe they started an oral contraceptive in their 20s. And then all of a sudden, out of nowhere, even though they've never had any other problems with weight, they'll just get this rapid expansion of fat, basically at their hips and thighs. And a lot of the times it can progress sort of down their legs and including their calves. And then it stops just right at their feet. And it creates something that we call diagnostically, we call it the cuff sign, where it truly looks almost like you could remove a pair of pants that you were wearing that were fat in more extreme cases. And then sometimes it also includes the arms.
So when these women came to you and said, I have lipedema, then what happened next? How did you learn about this?
So sort of being open-minded and curious, I sort of explored other relationships with other doctors who had patients with lipedema. And actually, a lot of these doctors happen to be plastic surgeons because a lot of the treatment involves sort of medical liposuction. And so in speaking with a lot of plastic surgeons, I learned more about lipedema. And then honestly, just following a lot of patients through their own journey of hearing their stories and then hearing from more patients, I just have sort of developed this niche of truly understanding lipedema and staying in tune with all the sort of latest and greatest guidelines. There is actually a set of guidelines that come with lipedema. A lot of it, unfortunately, isn't rooted in tremendous heavy research because there isn't a lot of research. And there's the Lipedema Foundation that is working on getting more research surrounding diagnosis and treatment modalities.
So when you first started working with patients who have lipedema, how did they feel when you said, this isn't just weight, this isn't just obesity?
Dr. Bitner, it's one of my favorite things because I just love talking to women who have lipedema because I think for the first time, women actually feel a bit validated because they'll go to so many doctors and they'll just hear, oh, you're just not exercising hard enough. Oh, you're just not being truthful about your food counting. You just must be overeating. And they're like, I work out so much. Like these women will have seen personal trainers, exercise coaches, they've gone to nutritionists, they've counted calories, they've counted carbs, they've done all these different things, everything that you can imagine. And despite all that, their weight still sort of grows and grows and grows at their legs. And unfortunately,
it doesn't grow anywhere else, right? So it doesn't
it grows at their legs and hips, and then it sometimes can grow at their arms. Oddly, it sort of spares the trunk. A lot of times it can come in the lower half of the tummy. So not so much the upper abdomen, but really lower, sort of below the belly button. And what's really frustrating about this weight is that it really hurts.
I was going to say, how do people feel?
Yeah. So women will talk about not only do their legs feel extremely heavy. And so when they're exercising and walking, it's just very taxing, more so than sort of another patient who has extra weight, but it hurts to touch. And women will say, like, if their kids sit on their lap or a pet, or if their partner tries to give them a massage, it just hurts and it feels terrible. It really limits a lot of their functioning in their day-to-day lives, like different work choices, their sex life. They have to sort of do different things for cleaning and self-care. They make modifications. So it really just changes almost every aspect of their life.
I'm going to close this door as you're talking.
I know, a little sneaky ghost.
I know my cat came in the room. So we're just keeping this real, everyone.
Yeah.
So, no, I love this because this so like helps people understand why they have symptoms, which is one of our favorite things at True. And I just love that you've become an expert in this. I mean, 1 in 9 women, really? I mean, this is really common.
Yeah. And I mean, I've been talking a little bit about lipedema, and I know you and I have sort of talked about, you almost, once you know about it clinically, you start seeing it in a lot of women, and you're like, yeah, I mean, I can see how there's that pattern of really excess adipose tissue sort of at the buns and the hips and the thighs, that you're like, that just doesn't seem that it should be there. And it just seems out of more heavily proportioned at the hips and thighs in comparison to other women or other people who are struggling with extra weight.
I know we have some pictures here available. Do you want to describe?
Yeah. So how we think about lipedema first is in terms of what we call a stage, and that's how progressed the adipose tissue goes. And so stage 1 obviously is pretty limited adipose tissue, all the way down to stage 2, 3, 4. How we categorize this is, in addition to just volume of adipose tissue, also the degree of nodules under the skin. Those are what is leading to a lot of the pain that people are feeling, as you get this fibrotic tissue that kind of comes in, and we'll talk a little bit more about that. But you can feel underneath the skin like bumps or nodules, and women will say it feels like rice or peas or beans, and they can feel it when they're touching their skin. Now, what I think is so telling about this picture is stage 1 and stage 2 is not that dramatic.
No, I mean, I can see the saddlebag is a bit different, right? Like how it collects on the hips.
More extensive. And a lot of the times we'll talk about an extensive, what we call a knee pad. And that's right at the knee. There's really heavy adipose tissue, more so than sort of an average patient. And their adipose tissue really extends pretty far down their calves, more so. Because typically in a patient who has normal connective tissue, it's really rare to see kind of excess fat at the calves, because really our calf is just muscle and ligaments and bone. And, we don't see a tremendous amount of adipose tissue.
So what are the different types of lipedema?
So the stage is sort of how progressed these symptoms are. The different types is where the adipose tissue is located. So if you have type 1, we're thinking of just at the hips and buns. Type 2 is extending all the way down into the thighs to the knee. Type 3 is all the way down to the ankle. And type 4 is the arms and the full leg. Now, very interestingly, I would say I mostly see type 3 and type 4. 5 is calf only, which I think is really quite rare. I haven't seen that as much. And I would say I mostly see either type 2, 3, or 4 for a lot of women.
Wow. And while we have this picture up, I'd love you to talk more about what is the difference between this tissue and just fat tissue? Because, right, it sounds like once this develops, it's not going to go down by just loss of weight.
Yeah. So, when we think about the difference between this tissue and adipose tissue, right? So when we're maybe over consuming maybe energy, right? Maybe a little too much food, or we're not moving as much, and there's that energy mismatch balance for a variety of different reasons. Our overall fat cells themselves, which are healthy, can either expand in size or in count. This is completely different. What this is expansion of these adipose tissues almost inappropriately. But what leads to that, and I think we have a picture that can show really how complicated this is, this rapid expansion of sort of diseased adipose tissue triggers your whole immune system to come on in and take care of that, sort of like a foreign body, like a virus. And then what our immune system does in the process of trying to take care of this diseased tissue, it will leave scarring or fibrotic tissue. And then it creates this whole mismatch of connective tissue where it's fat cells, scar tissue, and a bunch of other things that just does not allow that connective tissue to work properly.
Well,
So
it makes sense, like it would hurt, like it's inflammation, right? So it's like
inflammation.
Yeah.
And so that connective tissue not working properly means the nerves aren't working properly, the blood flow doesn't work properly, the concept of what we call our lymph, right? So that's just the flow of liquid within that connective tissue that when that gets blocked off in extreme situations can lead to further swelling down the legs. You know, a lot of times lipedema can be confused with lymphedema, right? Which lymphedema can come because maybe someone's heart isn't pumping as fast or their liver isn't working. And there's a whole backflow of blood that ends up pushing fluid into our legs. And a lot of people in their, later stages of life will talk about lymphedema. This is not that. And it's actually the in and around the lymph tissue itself, even though the heart is normal, the liver is normal, all these the plumbing is all normal, the tissue around the lymph really prevents that a proper fluid flow. And that can also lead to swelling.
So are there any factors that you've seen that increase a woman's risk for this? Like what might someone say, I'm at risk for this? Like if her mom had it, is she more likely?
Yeah. So there's not a tremendous amount of good data sort of understanding the different patterns. There's some genes that they've looked at, but they're not that strong of an association. We do see a lot of family history. So it isn't necessarily maternal versus paternal. Obviously, just because it affects women, a lot of women will talk about their maternal side. Their like moms and their aunts will usually have some sort of history of lipedema. So that's usually what we see. As of yet, there's not really an environmental factor that we've seen that has triggered this. And some of it has to do with, very similar to any other connective tissue, probably has some genetic piece that we just don't understand yet.
Sure. And I wonder too, if you can have someone who's diagnosed at, let's say, stage 1, I would imagine if treatment is started, is there actually a way to stop it from progressing?
Yeah. So what does sort of treatment look like? So the gold standard of treatment currently now is medical liposuction. So that's actually going in with the plastic surgery tools with a good plastic surgeon and removing some of that disease fibrotic tissue and disease adipose cells. And the hope of that is then that you would not have a progression of adipose tissue down to, stages 3 and 4. I mean, really the goal of doctors such as myself is to really not have anyone at stage 4, right? Kind of moving forward, because obviously that's pretty far progressed disease. And we're hoping that with, more understanding and education, both within the medical community and with patients, that we can start getting patients treatment sooner. It's very helpful to also support that connective tissue. So a lot of women find benefit from wearing, like compression stockings and doing manual lymph drainage or massage, where they're having experts sort of massage out some of the extra fluid that's there. But for a lot of women, that stuff sort of doesn't work. And we're still getting at the root of the problem of trying to take care of that disease connective tissue.
So let's say at a stage 1 or stage 2, do lifestyle options make a difference? Like it sounds like exercise and diet doesn't really make a difference.
Yeah. And so let's talk about exercise just for a second, because I think that that's super important. And everyone knows how much we love exercise and we love strength training. Although those things are important, it's actually not been shown to truly improve a lot of the expansion of adipose tissue. And a lot of women will struggle because in addition to that adipose tissue not being great, they can be have super mobile joints, which puts them at higher risk of having some sort of joint issue if they're trying to run or do some sort of, active cardio.
You mean like injury? So they're more likely to get injured.
Correct. Yes. A lot of the time, the recommendation, of course, is to have some safe strength training program. So trying to minimize injury as much as possible and maybe trying not to move as, very, very heavy weights that we sometimes would see, but still trying to expand that sort of adipose tissue.
Julie's asking, what about using a vibration board?
Yeah. So a vibration board it's one of those things that sort of people talk about using. A lot of the times we think that sort of gets that extra fluid within your lymph cycle moving. I've had some patients have loved their vibration boards and some people that it hasn't helped. So, a lot of these things, sometimes they can be expensive and it can be hard to sort of make a choice about, what you want to spend money on. If you can find one sort of at a good deal, it's probably worth a shot, but I wouldn't say you would be drastically missing out if you couldn't get one.
Understand. So
Yeah.
let's say lifestyle isn't making a big difference. What about medication?
So there isn't one medication that's been found that the FDA has approved for treatment of lipedema, but with my overlay of obesity medicine within the lipedema community, we found a tremendous amount of success with some of the newer drugs that we've been using for weight loss and diabetes. And I think even I don't know if we forgot to mention, but there's big news today that the drug that we've been using off-label to help treat weight, but has been approved for diabetes, called Mounjaro, or the generic name is tirzepatide, just got FDA approval also to treat obesity under the name Zepbound, which is very exciting. And the weight loss results within those trials are extremely promising, and people were losing upwards to about 25% of their body weight. So those drugs, in addition to helping women lose extra adipose tissue, have been really helpful for lipedema patients, not only about moving adipose tissue from their legs, but also treating their pain, which is so important, really, because, as we say, I care about weight the least. I really want women to be functional and feel just better. And so that's been really exciting. I would not be surprised in the next, 5 to 10 years if we really see that FDA expansion to cover lipedema.
That'd be exciting. So you say this is an inflammatory disorder. What about medicines that are used for inflammatory conditions?
There's not been any that have been shown to be particularly helpful. They've sort of run through the gamut of, NSAIDs and some of the other, other drugs that we'd use for something like rheumatoid arthritis, and those haven't been shown to be particularly helpful.
Well, that's too bad.
Yeah.
But so tell me about treatment that does work. So tell me more about.
Yeah. So we're really excited about some of these, newer drugs that are coming out, but truly what the gold standard is medical liposuction. So what that means is, so when we think about liposuction, a lot of people will think about cosmetic liposuction, where you're removing, small amounts of adipose tissue, maybe at the belly or a little bit at the thighs. It's a really small overall volume of tissue that's removed. When we're talking about medical liposuction, we're talking about removing very large amounts of tissue, upwards of 10 to 12 liters. And it's really important to have a plastic surgeon who knows what I'm going to backtrack and say a surgeon, and very preferably a plastic surgeon who very much knows how to handle this diseased tissue.
And this is a lot of fluid shifts, right?
So not only is it a fluid shift issue, but in speaking with some of these plastic surgeons, which I've spoken to several around the country, they really talk a lot about just even feeling the tissue itself. And it just feels different than regular adipose tissue that they're removing for maybe a cosmetic reason. And so in addition to the total volume that they're removing, they just have a different feel, and they know how to use different, believe it or not, there's actually different liposuction tools that they use and techniques, and they know the right ones to use so that they're not causing sort of issues after the surgery is over.
Perfect. So how do people do after the surgery? What happens next? I would imagine compression stockings and, once they
Yeah. So after surgery, we prefer patients to be sort of monitored in the hospital, because as you were talking about, that volume shift can really lead to patients' blood pressures diving and a lot of other issues. So it's good to have a situation where your plastic surgeon is doing surgery within a hospital setting, so that you can be monitored at least for 24 hours after surgery. And then over the next 4 to 6 weeks, it is a little bit of of just kind of laying low, wearing compression stockings, similar to a lot of other plastic surgery, and then slowly recovering as all of your sort of wounds and scars heal, and getting back to sort of functioning to sort of see how you're doing.
Sure. I'd like to think that scarring afterwards helps cement the tissues together so it can't recur. What's the recurrence rate?
Unfortunately, we don't know, right? So there can be some recurrence, and it's very interestingly that a lot of the expansion comes with with hormonal changes. So a lot of times we'll have this risk benefit conversation with patients, because if they're expecting to maybe undergo a pregnancy in the next couple of years, we'll actually pause medical liposuction in order for them to go through their pregnancy, have those hormonal shifts, right? And then get on the other end of that. And then maybe they'd want to progress to doing medical liposuction for fear of undergoing that huge hormonal shift and possibly having expansion of that adipose tissue again.
Yeah.
Ever more reason for women to know sort of what phase of ovarian function they're in, because, in coordinating these kind of really expensive and, imperative surgeries with, possibly going on or off different hormonal therapies is sort of imperative.
Sure. So Lisa's asking, do we have specialists locally who are familiar?
So I actually, I help people do the lipedema conversation. In terms of medical liposuction, no, we have, there isn't anyone within West Michigan that is familiar with lipedema medical liposuction. And we have some folks in Chicago and Atlanta and New Jersey that we actually send people to, that we've had a good success with.
Wow. So that's awesome that you've got those connections, but hopefully more plastic surgeons will take this on in the future.
Yeah, I mean, I think that now it's on the plastic surgery boards, which is pretty exciting, because that's really how it starts. I mean, as with your surgical background, as you know, that's how this sort of starts to change and become standard of care, to sort of have a better understanding of these disease processes.
Right.
And
part of it, unfortunately, is reimbursement, right? So if surgeons are reimbursed by insurance companies, what does the insurance coverage usually look like for this?
Believe it or not, it's gotten so much better. So we work with a couple of different groups that try to get insurance coverage for women. We're finding a lot of success if you can check the right boxes. And a lot of the times it is you need to have a surgical recommendation to have medical liposuction, and then a medical recommendation to have medical liposuction, and really demonstrating how much this, sort of disease tissue is affecting your life. I always make a joke, because women are just so amazing. And a lot of the times as we're talking, they sort of forget that, that this really has bothered them a lot. And I love just sort of providing them this space to be able to move forward, to say, let's, here it is, but let's do something about this. And we have a plan. So that's really—
What happens if a patient calls and wants to talk about this? What happens next?
Yeah. So what we would do next is have what we call lipedema consult, where we would have an exam and go through a history, and we would sort of ask a lot of these questions to sort of see if you fit the diagnostic criteria that would be helpful to diagnose someone with lipedema.
Sure. And then once you've diagnosed them and you're able to document that they have this, what happens next?
So what happens next is we usually work with the insurance company to make sure all of our boxes are checked. And then you would work with a surgeon to plan out the timing of surgery and to see if that makes sense. A lot of women will, if we have the capacity and the coverage, will usually start something like tirzepatide or one of those other GLP-1 obesity medications, and trying to get some of that adipose tissue down or closer to goal before the surgeon goes in, because the surgeons have told me that it's a much more successful surgery at getting at some of the fibrotic tissue removed.
Awesome.
Yeah.
This is super exciting. I mean, just since I've learned about this from you, even traveling in the airport, I've seen women with lipedema, and it's just like, I wish I could say there is help for you. So I just hope we can shout this from the rooftops.
Yeah. Yeah. And it's, we have one more question. Probably need to prove it medically and not just come out. Yes. So as always, for a lot of, as a lot of medical procedures surrounding weight, insurance companies sort of hedge on trying to understand the role of coverage. And so, in general, they don't usually like to cover cosmetic surgery. And we do very closely try to make a good argument that this is medically necessary to improve someone's life.
Sure. And I bet it goes back to the pattern and the stage and all of that. So to have—
It does. Yeah. Yeah. So obviously the more progressed the stage, the more likely this will be covered. In general, we try to get women going before their sort of progressed stages, just because obviously that extra weight on the other joints is just not, it's just not ideal. We want to sort of preserve function as long as possible.
So the surgeon in me wants to know, like, let's say someone is a stage 1. what about doing a biopsy of the tissue? It seems like from the picture of the type of tissue, it would look very different under a microscope. How often is that done?
Yeah, it's rarely done. And I think some of it has to do with some of the diagnostic criteria that they have and the ability to do that. So honestly, that's rarely done, which is really interesting. And I think they're
It seems
trying
like
to,
it would make sense.
yeah, you would think that you'd be able from a pathology standpoint, be able to look at the different
Right.
disease tissue. I don't think there's enough to sort of come up with any confirmed diagnostic criteria.
I think we have a lot of work to do in this field.
We have a tremendous amount of work. That's why, I love the lipid. If anyone wants more information, there's the Lipedema Foundation, who is working very hard on creating more research and trying to support researchers within this field. They also have a data bank that if you have lipedema, that you can sign up and then you can be in the know about different treatment options and possibly research studies that are available to help you out, and which is really exciting and interesting and sort of being part of the future. And maybe you'll get on a study where there's some latest and greatest and it works for you, and that's great.
That'd be awesome.
There's a lot of back and forth about the lifestyle stuff. In general, we talk, I think some of the strongest recommendations are for like anti-inflammatory diets. So, right, pulling out some of, thinking about whole foods, lots of vegetables, lots of plants, pulling out processed foods in general always seems to be a great place to get started. But by no means is that the only thing that's helpful.
Oh, I love that. And I'm sure that it's just going down that list, and lifestyle's not working, it fits the pattern, then to progress to the meds and potentially move to surgery.
Yeah. And I think just like in menopause, when we say, to women, you don't have to suffer in silence. I feel the same way about lipedema. You do not have to suffer, right? You do not have to be told again just to go work out harder and sort of just crank your brain about what is the next exercise program I should join? What is the next,
Right.
diet should I try? And I love just providing this space where we can come up with truly a plan that makes sense for women. And
It can be so defeating, right? It can be so defeating if women are just trying something and don't see any progress. I can't imagine.
Yeah. And I think, particularly, I think the other symptoms that come along with that, right? Just the pain at the legs and just,
Right.
just how these women are just like, they're like, I just want to like play on the floor with my kids, right? And what a struggle that is for them. And so if we can help correct some of that, it's just really amazing.
And again, I know this is, just one of your favorite things to help women. Like, what does it feel like? And maybe tell us a story of what it's been like for someone who's gone through this.
Yeah. So, I mean, I've been taking care of women who have lipedema for several years. And so some of them have been through surgery, and they're so excited and thrilled, right? I mean, they can move, they feel flexible again in terms of just being able to do flexible both from their body, but mentally and just in their life,
It doesn't run their life anymore, right?
No, it totally doesn't. And it's really exciting. It truly feels great. I mean, to be able to provide this space for women and help them sort of move along a path. And it's great. It's like one of the best things in medicine to be able to do some of this stuff.
That's right. Well, I'm so grateful you've taken this on. So I know we always like to share questions for people to ask their primary care doc. So if you were to say, what do you want women to be able to ask their primary care docs, and how they can get answers?
Yeah. And I'm just going to answer Lisa's question real quick.
Okay.
Does it come back? So it can come back even after a medical liposuction. And a lot of times we see that it can come back during times when women have a huge hormonal shift. So maybe if you've gone through menopause or had to use hormones for a different reason, we can a lot of times see it come back.
So you're saying it sounds like when estrogen goes up, but if estrogen replacement, I would imagine there's not a whole lot of research that's been done about this, because of course for menopause hormone therapy, we're trying to just keep the levels stable. So is it more puberty and pregnancy, or?
So it's mostly puberty and pregnancy, but it is perimenopause. There are times where it's perimenopause as well, but also women, if they're going on like an estrogen blocker, like breast cancer therapy, a lot of times that can also cause a rapid expansion of adipose tissue. Well, so there's some sort of connection there. I don't know.
Right. It's really interesting, because in perimenopause, of course, what we know is what happens is sometimes instead of a woman just making one egg, she might make 3 or 4 or 5 in the perimenopause. And I can really see, I mean, it makes fibroids grow, it makes endometriosis grow, and sounds like it can get this process going.
Yeah. Yeah. Either way, I think it just feels frustrating to have this huge times of your life be accommodated with, this very
One more thing.
confusing.
One
Yeah.
more
One
thing.
more thing to think about. That's right.
Crazy.
All right.
Let's
So
get to those questions you want.
let's talk about questions. Number one, do I have lipedema? Right. So lipedema, as we've already talked about, is a clinical diagnosis. It's fair to have that conversation to see if your primary care doctor even knows what lipedema is. If they don't, as we've given you some resources between the Lipedema Foundation, obviously we all here at our office at True, we'd always love to have a conversation with you about it. But there are ways to have a diagnosis between history and physical exam that give us some clues about whether or not you have lipedema.
Perfect. And question number 2.
Do you have a lipedema specialist review my symptoms? So, as we at True, we love our patients to be advocates for themselves, and we always want to make sure that if your primary care doctor doesn't know, that's okay. Not every doctor knows everything about every symptom, but at the very least, they should have a direction to send you in. There are, from the Lipedema Foundation, a lot of times you can find specialists, and there's some other sort of groups out there that can help you find a specialist sort of maybe close to you or even via telemedicine that can be helpful.
Sure. I wonder if there's probably even support groups on like Facebook or Pinterest.
There totally are. There's something called the Lipedema Sisters on Facebook.
Awesome.
That's helpful. I think one of the things that can be hard is that you have to sort of verify that you have lipedema. And they kind of guard that because they really want to make it a safe space for women that have lipedema.
That's wonderful. Cool. So what else should people be able to ask their doctor?
All right. Number 3. Would I be a candidate for a weight loss medication to treat my lipedema? So we always want to make sure that patients know, one, if they would be a candidate for weight loss medication. So you're a candidate if your BMI is above 30 or above 27 with a comorbidity such as hypertension, cholesterol problems, high blood sugar, sleep apnea. I think we'll move into a period beyond with the rapid expansion of these medications and as the indications expand, I think we will get to a point where even if you don't meet that criteria, which is quite rare, even based off of a weight number, that even if you had lipedema, you'll probably end up getting coverage for some of these newer medications that are coming out to treat sort of the inflammatory process as well as providing weight loss.
Awesome. So it's again about patients being advocates for themselves.
Yeah. And I think within the lipedema community, there's a lot of women who are so excited about some of these other newer medications because some of the other medicines that we use for weight loss, such as Contrave or Qsymia, which I use and I have a lot of great success for women who have obesity, they just have not been as successful with lipedema fat loss. And for the first time, some of these other newer drugs have been. So that's quite exciting.
That's so important to know. All right. Question 4.
All right. What resources are available to assist with my lifestyle changes? We talk about this all the time that, making a huge shift to exercising, maybe making dietary changes, working on your relationship with food can be hard, right? Even I think particularly that relationship with food piece when maybe your partner or your family or your social groups are not in the same vibe, kind of trying to make those choices within social settings or at home can be super hard. But there are ways that you can sort of support yourself, and whether it's a nutritionist, a food therapist, or sort of other modalities, like such as food tracking or different ways to sort of provide guidance on making lifestyle changes can be really helpful. We talk a lot about seeds. We find that to be a great way to sort of organize your lifestyle changes and a great place to get started. But there's a lot of sort of stuff that's out there that your primary care doctor should be able to assist you with.
Perfect. And last but not least,
do you have a trusted plastic surgeon? So this is super important. So there's a lot of surgeons who are out there trying to, I think, let's all hope that they're good intention, trying to find a place to for lipedema patients to go to sort of have a treatment option. Unfortunately, some of them don't necessarily have the best results. And we really I would love as a lipedema specialist for all patients who have lipedema to try to find a plastic surgeon that works within this space and is familiar with, kind of working with this tissue. I'm not a surgeon myself, and maybe Dr. Bitner, you can speak to this, but I mean, really getting in there and feeling tissue can really make a difference in your decision-making in the moment.
It really can. And it's, surgery is so much a matter of experience, of course, starting with good training, good understanding of anatomy, but so much of it is experience about how much to do, how much tissue to take off. I'm sure that's a big part of it. So again, I love that you're connected with people who are experienced in this, and hopefully all of you out there, if you talk to your primary care doc, that they would have someone as well. And hopefully the Lipedema Association is able to keep a registry of trusted plastic surgeons.
Yeah, I mean, I think we are always available to sort of help patients if they have more questions, and whether it's diagnosis, medical choices, where do I go next in terms of seeing a plastic surgeon. And we keep trying to help women all over. So we keep expanding our states that we can help people in. And
just expanded to Ohio.
Yeah, just to Ohio. We're really excited to help the Ohio people, even though I'm sure. So don't hold that against me, patients from Ohio.
Exactly. And I see here that there's we've put the link in the chat for the Seeds ebook. So again, we're not saying that these lifestyle changes might help lipedema, but at least it's making sure that you've got a healthy lifestyle, you're doing what you can, but then to definitely get help if it's not making the difference you want it to make.
Yeah. And I think it's always a good place just to, have a framework to get started. And maybe, in terms of even our protein guidelines, maybe aren't necessarily where you want to be. It does provide the beginning to even just start thinking about protein. Am I eating enough? Right. Or even just having that beginning.
Just having that foundation. Awesome.
Yeah.
Again, Dr. Egan, thank you so much for taking on this exciting work. And we just hope that, lots of women are helped by us being here on Facebook Live. For those of you who are watching on Facebook or YouTube, please share this with people that might benefit from it. And we look forward to staying in touch.
All right. Thanks for this topic.
All right. Thank you.
Bye-bye.